So I'd like to bring to you, to close us, the Executive Director of Wilder Research, Paul Mattessich.
Well, I would repeat all of Lee's thanks to everyone here, as well as to the partners, the sponsors. I was asked to take just a minute to indicate what I saw as some highlights that I would take from this as we move forward with the partners, the sponsors, and with all of you to do continued work on this topic. It's been a very informative and inspiring morning to conclude this series of forums. I think that that inspiration has come from the fact today that in a general sense, we've learned about this issue more at a high level and a general level, as well as a very practical level. And you could see that through all of the presentations and the discussions that we had today. Dr. Boss telling us that this is a significant issue, and one of the major things it needs is a name. Giving it this name of ambiguous loss makes it more tangible for us. It's something we can work with, and it's also important to understand that we have to see it both through an ambiguous loss lens, but also as something which is a systemic issue, that the pathology is in the system and not in the individual, certainly not in the young people who are affected by this issue. And she brought it from the theoretical, though, down to the practical, offering some specific techniques and ways and styles that can be added into the repertoire of techniques that practitioners can use in order to work more effectively with young people who are affected by parental incarceration. And we saw in Dr. Davis's remarks some of the parameters, some of the dimensions of this as a public health issue. How many children it's affecting, where it's affecting them, what their characteristics are. And that's very important if we're going to get the systems, the formal systems, to move ahead and think in terms of practical things like public policy and financing, and how it is that we can really facilitate the solutions that we also heard described this morning. And in the panel, we heard different perspectives, again, on the practical issues that we have to address if we're going to provide effective therapy, not thinking of that as just a traditional way of one person talking to another person, but elevating it and thinking about it systemically in terms of the formal system, the family, the community in doing more. Some of what came out were logistical issues that should be readily remediable. You know, changing the times when therapy is offered, or offering more information so that people like Naomi can have a better understanding of exactly who's affected by this and not, and can intervene. So some of it operated at that level. Or we heard the importance of giving young people more mastery, more control as a possible solution, but doing it in a way that Dr. Boss emphasized has to be with the acknowledgement that no situation will ever be perfect. No family will ever be perfect. We have to tolerate ambiguity. Families are kind of moving equilibriums that will always require some care, some nurturance, and that are always striving for the best, but may not ever actually achieve it. Having that recognition enables us to better work practically with people who are affected by this issue. And then I have to say that I absolutely loved at the end the creativity, the innovation that we saw demonstrated by this think tank up here in a variety of ways as they were bringing up suggestions, and maybe especially when Erica suggested the way of enabling parents to be more therapeutic, and then immediately Shania added her perspective to it and modified it, and Naomi brought in some of the issues that would be necessary in order to give that time, place to kind of flesh it out. That illustrates the sort of thing that we need to be doing as we move forward, as Lee encouraged us to do, to address this issue. And we at Wilder Research certainly look forward to doing that with you. Again, thanks for coming today. It's just been a very informative and inspiring day, and thanks to all of you.
Thank you, everyone. Thank you for coming. I wanted to mention, because I am an evaluator and a researcher, and I'd be remiss for me not to mention that a survey will be sent out to you. If you're eager to fill out one right now, there's the web address. Otherwise, we will send it out with the presentations and a follow-up email. And we also have recorded this event, and so you'll be able to, we'll send you the link to those on YouTube. You can see the other forums on the YouTube page as well, so you'll be sent there. It's also located on the, currently on the on our collaboratives website as well. So feel free to stay and network, grab some more coffee or food, and there's brochures and other things outside. If you need your CEUs, you can sign back outside and get your get ready to get that as well. But thank you, everyone.